You have probably asked a doctor, a therapist, or even yourself this question: how long until my back finally gets better? And maybe the only answer you heard was, it depends, which does not help you sleep at night or plan your life. Most people with back pain over 50 want one simple thing: a realistic timeline. Not a miracle, not a guarantee, just an honest sense of when they might feel a little less trapped by their back. The truth is, your back can start to improve in weeks, even if your scans never change, because recovery is less about a calendar on the wall and more about how your muscles, joints, and nervous system adapt to the way you move and treat them. This video is going to give you a clearer picture. What often happens in the first few weeks? What can change in the next few months? Why some people get stuck? And what you can actually do so you are not just waiting and worrying. My name is Dr. Robert Ellis, and for more than 20 years working with older adults, this has been the most common question in the room. How long until this improves? By the end of this video, you will not hear "it depends" and nothing else. You will have a simple, honest roadmap and a way to measure progress that does not rely only on pain going from 10 to 0 overnight. Most medical articles divide back pain into 3 big phases by time: acute, up to 6 weeks; subacute, 6 to 12 weeks; chronic, longer than 3 months. In many people, especially with new, non-specific low back pain, symptoms improve a lot in the first 6 weeks. Some studies report that a large portion of patients with a recent episode have substantial reductions in pain and disability within that time, even if some discomfort lingers. In older adults, the story is more mixed. Research on seniors with new back pain finds different trajectories. Some recover quickly, some slowly, and some stay about the same over several months. That does not mean nothing can help. It means there is a range, and your path depends on more than age alone. One thing is clear across many studies: people who stay as active as they safely can, who start gentle exercises early, and who avoid long periods of bed rest tend to do better over time than those who stop moving out of fear. Short-term rest can calm a flare, but longer-term inactivity can weaken muscles and stiffen joints, which can slow or block recovery. So when you ask, how long until my back pain improves? Part of the answer is in the calendar, and part of it is in your habits. The tissues do have healing timelines, but your pain experience also depends on how your nervous system and muscles adapt to movement, which can begin to change in just a few weeks of consistent, appropriate activity. Now, let's talk about the biggest enemy of realistic recovery. Not your age and not your MRI, but the expectations and messages around you. You live in a world of extremes when it comes to back pain. On one side, you hear, just rest, it will go away, as if any activity is dangerous. On the other side, you see quick fix promises. Fix your back in 7 days, one stretch to cure back pain. Do this once, and you're done. Neither of those messages fits the way an older body actually heals and adapts. The health system itself can add to the confusion. You may see one provider who tells you it's just a strain, another who orders imaging that sounds frightening, and a third who says, well, at your age, you'll have to live with some of this. You might get a short burst of physical therapy and then be sent home without a long-term plan, or you might be given only medication without any clear guidance on movement. This environment makes it very hard to set realistic expectations. If you hope for a cure in a week, you will almost certainly be disappointed. If you have been told that nothing will ever change, you might not even try. Both extremes can push people to quit the things that actually help, like gentle exercise, pacing, and building strength, long before those things have had time to work. The real systemic enemy is this: unrealistic timelines and all-or-nothing thinking about recovery. When you expect quick, total relief, you may judge a slow but real improvement as failure and stop your program. When you expect nothing to help, you may never start. Both rob you of the chance to see small changes add up. Underneath the frustration with how long lies a hidden condition that many older adults never hear named: recovery impatience and nervous system sensitivity. Pain is not only about damage. By the time you have had back pain for weeks or months, your nervous system often becomes more sensitive. The pain pathways in your spinal cord and brain get better at firing. They become trained to react. At the same time, your muscles may weaken and your confidence in movement drops. This combination makes it feel like nothing is improving, even if the original tissue irritation is slowly settling. Recovery impatience makes this worse. If you expect to feel 100% better after 2 weeks of exercise or therapy, you will likely feel discouraged when that does not happen. If you stop at that point, 2 weeks, 3 weeks, you never give your muscles or nervous system the 6 to 12 weeks they often need to adapt in a noticeable way. Many people describe this without using the technical language. They say, "Every time I start something, I quit after a couple of weeks because it doesn't seem to work." Or, "I'm better, but not enough, so I guess this is pointless." What they are feeling is the clash between the real timeline of adaptation and the imagined timeline in their mind. The hopeful part is that nervous system sensitivity and deconditioning are not fixed. They can be reshaped gently, with consistent, well-paced movement, and with a more accurate picture of what better looks like week by week instead of all at once. That is what this video will help you build: a more forgiving, more realistic understanding of how long back pain improvement can take and how to stay with the process. Over 2 decades in geriatrics, there have been patients in their 50s, 70s, even 80s walking into the office with the same question you are asking now. Some had pain for a few days, some for months, some for years. The answer was never just a number. It was a conversation about their particular situation and what they were willing and able to do next. From that experience, and from the research, a pattern emerges. Many new, non-specific back pain episodes improve significantly within the first 6 weeks. Further gains often happen over the next 6 to 12 weeks, especially with good care and exercise. Even after pain has lasted more than 3 months, function and pain can still improve over longer periods with the right plan. The people who did best were rarely the ones who recovered in a single dramatic jump. They were the ones who understood that back pain recovery is often a series of small steps. A little less pain here, a little more walking there, a little more confidence bending or standing, accumulating over weeks and months. So instead of asking, "When will this be over completely?" a more useful question is, what kind of improvement is realistic in a few weeks, a few months, and beyond? and what helps me get there? That is what the next part of this video will lay out, step by step. Let's break the recovery journey into 3 levels, from the smallest, most immediate changes to the deepest, long-term ones, and connect each one with what is happening in your body and in your daily life. Level 1. The first few weeks, calming down and moving again. Mechanism. In the first days to weeks after a flare or new episode, a lot of what you feel is driven by tissue irritation and your body's protective response. Muscles around the painful area may spasm, joints may feel stiff, and your nervous system may turn up the volume on pain to make you slow down. At this stage, the goal is not to become strong. It is to reduce intense inflammation, keep as much gentle movement as you can, and avoid sliding into complete rest. Staying gently active, walking short distances, doing easy back-friendly movements, keeping up with basic daily tasks as you are able, helps prevent rapid deconditioning and joint stiffness. Short-term medication, heat, or manual therapy can also play a role here to calm symptoms so that you can move. Study systematic reviews. Note that many people with non-specific low back pain show significant improvement in pain and disability over the first 6 weeks, and guidelines recommend staying active and avoiding prolonged bed rest. Physical therapy programs in this early period often focus on education, relative rest, and gradual reintroduction of movement rather than heavy strengthening. Daily life relevance. In daily life, improvement at this stage might mean being able to sit a little longer before your back tightens, taking a short walk around the house or block without needing to stop as often, getting out of bed or a chair with less of that gripping, take your breath away pain. These may seem like small wins, but they are important signs that the fire is cooling and your body is starting to trust movement again. Level 2. Weeks to a few months. Building strength and retraining control. Mechanism. Once the worst of the acute flare has eased, often somewhere between 2 and 6 weeks, the focus shifts. Now, the key drivers of your pain and limitations are less about raw inflammation and more about weak, tired, and poorly coordinated muscles and a nervous system that is still on edge. This is when strengthening and stability work become especially powerful. Your back, hip, and core muscles start to adapt to exercise. They can grow stronger and endure longer contractions. Your nervous system learns better timing and control for those muscles, so your spine does not wobble or stiffen too much when you move. These neuromuscular changes do not happen overnight. Some studies on strengthening and motor control programs show measurable improvements in strength, endurance, and movement patterns over about 4 to 8 weeks of consistent training. That does not mean you feel nothing before that. It means that the deeper, more stable improvements usually need several weeks. Study research on exercise programs for chronic and subacute low back pain often uses 6 to 12-week interventions, and many report meaningful improvements in pain and function over that period when people adhere to the program. Studies of neuromuscular adaptation show that the nervous system and muscles can begin to change in their coordination within a few weeks of regular training. Daily life relevance. In your life, this stage of recovery might look like being able to walk farther or stand longer before your back starts to complain. Noticing that everyday tasks, carrying laundry, climbing a few stairs, standing at the sink, feel less draining. Feeling more stable and less fearful when you bend, turn, or reach. This is also the stage where many people are tempted to quit, because progress is real but not dramatic. Pain may still come and go, but if you keep going, this is where your back's baseline can start to shift to a better place. Level 3, months and beyond. Changing your trajectory. Mechanism. When pain has lasted for more than 3 months, it is often called chronic. This does not mean it cannot improve. It means the pain system and your movement patterns have settled into a longer-term pattern that may require more time and consistent effort to change. At this stage, recovery is less about healing a single injury and more about reshaping your daily life, your activity level, your strength, your sleep, your stress, and your beliefs about your back. Long-term improvements can still happen as your physical capacity grows and your nervous system becomes less protective. Study research on long-term trajectories of back pain shows that some people continue to have low pain and disability over years, while others have fluctuating or persistent problems. Factors linked with better long-term outcomes include staying physically active, having more positive expectations about recovery, and engaging in self-management strategies like exercise and pacing. Daily life relevance. For you, this might mean that over 6 to 12 months of the right kind of movement and self-care, you need fewer pain medications or lower doses, recover faster from small flares, can do more of what matters to you, travel, hobbies, family activities, even if some discomfort remains. At this point, the question, how long until I'm 100% better, becomes less helpful than, how much better can my function and pain get if I keep working at this? For many older adults, that shift leads to more satisfying, sustainable progress. All of this leads to another important truth. Your timeline is not just about pain. It is about the kind of life you want around that pain. If you picture recovery only as a day when you feel absolutely nothing in your back, you may miss the many forms of improvement that truly matter. Being able to walk with your spouse again, being able to stand and cook a meal, being able to play with a grandchild, even if you pay a little soreness later, but not days of agony. A realistic recovery plan after 50 is less countdown to zero pain and more steady progress toward more movement, more confidence, and less interruption from pain. That is what supports independence and longevity, the ability to keep moving, keep connecting, and keep taking care of yourself safely. Back pain is a part of your story, but it does not have to be the whole story. How you move, how you pace yourself, how you strengthen, and how you think about your back can all nudge the trajectory toward more freedom instead of more fear. You also do not need to become a fitness person to do this. You do not need to love gyms or heavy weights. You need to see yourself as someone who is willing to give their back and their body a fair chance to adapt, with realistic expectations about time. Instead of, if I don't feel amazing in 2 weeks, this isn't working, a more helpful identity is, I am the kind of person who gives my body 6 to 12 weeks to adapt to a new routine, and I look for small wins along the way. That identity shift from impatient, discouraged patient to patient, active partner is often where recovery really begins. You are not a bad back. You are not too old to change. You are someone whose body still responds to training and care, just on a slower, wiser timeline than at 20. If this way of thinking about how long until back pain improves made sense to you, here is a gentle next step. Give yourself a 6-week window for your next plan. Choose a simple, appropriate exercise routine. Build in daily, gentle movement and track not just pain, but what you can do. At the end of 6 weeks, look honestly at the small changes in pain, in walking, in confidence, and then decide how to adjust, not whether to quit everything. This is Dr. Robert Ellis. If this video helped you feel a little less lost about your back pain timeline, consider liking the video and subscribing to the channel. It helps more people over 50 find calm, realistic guidance instead of only scary stories and empty promises. You are not too old for your back to improve. You are not too late for change. You are simply working on a body that needs weeks and months, not days, to adapt. And you deserve clear information and gentle support